Have you ever wondered why your blood pressure stays high even though you're doing everything right? You eat healthy, you walk every day, and you take your medications exactly as prescribed. Yet, the numbers on the monitor barely move. Here's the shocking truth. Cardiologists reviewing studies from Harvard Health and the National Institutes of Health found that millions of people over 60 are unknowingly taking everyday pills that quietly raise blood pressure. Many of these medications are meant to help with pain, allergies, or mood, but they can secretly work against your heart. You won't feel it happening. These pills don't cause an immediate spike. Instead, they slowly tighten blood vessels, make your body hold extra salt and water, and force your heart to work harder over time. Over months or years, this can lead to stubborn high blood pressure that no diet, exercise, or prescription seems to fix. The danger is that most people never connect the dots because these drugs are sold everywhere, even without a prescription, and are often considered safe for daily use. If your blood pressure refuses to improve, even with treatment, one of these common medications could be the hidden reason. These drugs can interfere with how your body regulates sodium and fluid balance, causing subtle but persistent rises in blood pressure. For older adults or those already dealing with hypertension, this extra strain can quietly damage arteries, increase the risk of stroke, and weaken the heart over time. One of the most surprising and widely used types of medicine that can do this are common pain pills. You might know them as Advil, Motrin, or Aleve, or by their generic names ibuprofen and naproxen. These are nonsteroidal anti-inflammatory drugs, or NSAIDs, and they're taken daily by millions of people for arthritis, headaches, joint pain, and back aches. While they can provide temporary relief, long-term or frequent use of NSAIDs can subtly raise blood pressure by making the kidneys retain salt and water, and by reducing blood flow through the kidneys, which indirectly increases the pressure in your arteries. What makes this especially concerning is how easy it is to overuse these medications without realizing it. Even a couple of pills a day, when taken over weeks or months, can have cumulative effects. People often assume that because they're available over the counter, they're harmless. But studies have repeatedly shown that regular NSAID use can increase average blood pressure by several points. And for those already hypertensive, that can be enough to tip the balance from controlled to uncontrolled. Understanding this hidden cause is crucial because switching to safer alternatives, such as acetaminophen in moderation, or non-drug pain relief methods like gentle stretching, heat therapy, or physical therapy can make a measurable difference. For many people, simply reviewing their current medications with their doctor or pharmacist can reveal the unsuspected culprit behind years of stubborn high blood pressure. They're the little pills millions of people over 60 reach for when arthritis flares up, when the knees ache, or when that familiar back pain starts again after a long day. They're so common that many people don't even think twice before taking one. After all, they're sold everywhere. No prescription needed, just a quick fix within reach. But here's the shocking truth most people never hear. These same pills can quietly push your blood pressure higher without you feeling a thing. According to cardiologists at Harvard Health and the Mayo Clinic, pain pills from the NSAID family, short for non-steroidal anti-inflammatory drugs, can interfere with the way your kidneys manage salt and fluid. Normally, your kidneys help keep your blood pressure stable by flushing out excess sodium and water. But when you take these pain relievers regularly, they disrupt that balance. Instead of letting go of extra fluid, your kidneys start holding on to it. That trapped water increases the total blood volume in your body, which forces your heart to work harder to push it through your arteries. At the same time, NSAIDs cause your blood vessels to tighten. This double effect, extra fluid and narrower vessels, makes blood pressure slowly climb higher over time. You won't feel it happening. There's no sudden pain or warning sign, just a gradual rise that can add 5, 10, or even 15 points to your readings before you realize something's wrong. A large study from the American Heart Association followed adults who took ibuprofen or naproxen daily for just a few months. The results were clear. Even short-term use caused noticeable increases in blood pressure. For older adults who already had hypertension, that small rise was enough to trigger serious complications. Heart strains, swelling in the legs and ankles, and even a greater risk of stroke. Now, it's important to be fair. These medicines aren't evil. When used occasionally for a headache, a toothache, or mild pain, they're safe for most people. The problem starts when they're taken day after day, often without realizing the potential damage. Many seniors keep them in the bathroom cabinet or purse and take them automatically, like vitamins, assuming that if they're sold over the counter, they must be harmless. But for someone managing high blood pressure, Those tiny pills can quietly undo the benefits of healthy habits, diet changes, and even prescription blood pressure medications. It's one of the most overlooked reasons why blood pressure can stay stubbornly high despite doing everything else right. The good news is that there are safer ways to manage pain that won't raise your blood pressure or strain your heart. Simple options like acetaminophen, gentle stretching, warm compresses, or natural anti-inflammatory foods such as ginger and turmeric can help ease discomfort without the cardiovascular side effects. If you find yourself reaching for pain relievers every day, it's worth having a conversation with your doctor or pharmacist. They can help you find the lowest effective dose or switch you to a safer alternative that won't quietly push your blood pressure higher. Think about this for a moment. The American Heart Association estimates that more than 30 million adults in the US use these pain pills each week, and most have no idea that what's helping their joints could be quietly straining their heart. So before you reach for that familiar bottle again, remember, what seems like a simple fix for pain might come with a hidden cost. And speaking of hidden dangers, the next pill on our list is one almost everyone has taken when they catch a cold. Yet cardiologists warn it can spike your blood pressure even faster. Number 4. Cold and sinus pills. Let's talk about something nearly everyone has used at some point. When you feel stuffed up, tired, and can't breathe through your nose, it's easy to grab an over-the-counter cold remedy. Brands like Sudafed, Dayquil, and even some non-drowsy allergy tablets promise fast relief so you can keep going with your day. But what many people don't realize is that these little pills can have a surprisingly powerful effect on your blood pressure. And not in a good way. Cardiologists warn that many cold and sinus medications contain ingredients known as decongestants. The two most common are pseudoephedrine and phenylephrine. These compounds work by shrinking the blood vessels in your nasal passages, helping you breathe more easily. But they don't just act in your nose. They also tighten blood vessels throughout your entire body, including those around your heart and brain. This widespread constriction makes your heart work harder to pump blood through narrower pathways, causing blood pressure to rise, sometimes very quickly. For people with existing hypertension or heart problems, this sudden increase can be dangerous. A Harvard Health report put it simply, even a single dose of pseudoephedrine can raise blood pressure by 10 points or more in adults over 60, especially those already managing high blood pressure or cardiovascular disease. That kind of jump can push them into a risky zone almost instantly. The real danger is that most people assume these medications are harmless because they're sold without a prescription. But when taken during a cold or flu, especially alongside other medications, decongestants can create a sudden, silent surge in blood pressure that often goes unnoticed until symptoms like headaches, chest tightness, or dizziness appear. For older adults, even short-term use of these cold and sinus pills can have a cumulative effect, stressing the heart and arteries when they're already more vulnerable. It's one of the reasons cardiologists often caution their patients with high blood pressure to avoid decongestants altogether, and instead look for cold and flu products labeled decongestant, free, or safe for high blood pressure. For some people, that sudden rise in blood pressure is enough to trigger dizziness, headaches, or even a dangerous spike that sends them straight to the emergency room. The Mayo Clinic has issued similar warnings, explaining that these cold and sinus medications can interfere with common blood pressure drugs. So while one medicine is working hard to lower your blood pressure, the decongestant in your cold pill may be pushing it right back up again. Doctors often describe it as a tug of war inside your bloodstream. You think your numbers are under control, but for several hours after taking these pills, your blood pressure can quietly climb without you realizing it. Here's the shocking truth. Even many sinus or multi-symptom formulas that seem harmless can contain hidden decongestants. They're often labeled with small letters like D for decongestant, such as Mucinex D-Claritin D or Allegra D. That tiny letter can make a big difference to your heart. A 2023 study from the Cleveland Clinic followed thousands of older adults who regularly used over-the-counter decongestants during cold and flu season. Researchers found that nearly 1/3 of participants experienced measurable increases in blood pressure, and about 10% developed new heart rhythm problems during those months. So what can you do instead? Doctors recommend safer, heart-friendly alternatives like saline nasal sprays, humidifiers, or acetahistamines that don't contain decongestants. You can also use warm fluids, steam inhalation, or nitty pot to clear congestion naturally. If you absolutely need medication, look for labels that say decongestant, free, or safe for high blood pressure. Pharmacists can help you find the right products. And remember, even natural or herbal cold remedies can sometimes affect blood pressure, especially if they contain caffeine, licorice extract, or other stimulants. Always check with your doctor or pharmacist before mixing anything new with your regular medications. Cold and sinus pills are designed to help you breathe easier, but for people over 60, they can quietly make your heart work harder than it should. So the next time you catch a cold, think twice before reaching for the strongest sounding box on the shelf. Sometimes the medicine that promises quick relief can come with a hidden cost: higher blood pressure. Now, the next pill on our list is one that millions of people take every single day, not for pain or congestion, but to control mood, anxiety, or sleep. And new studies show it can also push blood pressure higher in ways most doctors never explain. As number 3, antidepressants and sleep aids. Let's talk about a group of medications that often go unnoticed when it comes to their effect on blood pressure: antidepressants and sleep aids. It might surprise you, but some of the most common prescriptions for mood, anxiety, or insomnia can gradually increase blood pressure over time. Medications like Zoloft, Prozac, Paxils, and even older antidepressants such as Ilavals and Mitriptyline are widely used among adults over 60. In fact, a 2023 report from Harvard Health found that nearly 1 in 4 older adults in the U.S. takes an antidepressant or sleep medication regularly. According to cardiologists at the Mayo Clinic, certain types of these drugs can tighten blood vessels or interfere with the body's ability to properly regulate adrenaline and serotonins, both of which play major roles in maintaining healthy blood pressure. When these systems are disrupted, the result can be a slow, steady rise in blood pressure that often goes unnoticed for months or even years. Here's how it happens. Steroids also influence how your body handles stress. Normally, your adrenal glands produce hormones like cortisol in small, controlled amounts. But when you take steroid pills such as prednisone or cortisone, your body receives a much higher dose of synthetic cortisol. Over time, this excess cortisol can disrupt the body's natural rhythm and increase levels of circulating stress hormones like adrenaline. Those hormones cause your blood vessels to constrict and your heart rate to rise, both of which raise blood pressure even further. Another issue is that steroids can alter how your body processes sugars and fats. They increase insulin resistance, promote weight gain around the midsection, and elevate cholesterol levels, all factors that place extra strain on the cardiovascular system. When combined with the water and salt retention steroids cause, the result can be a perfect storm for high blood pressure and heart stress, particularly in older adults. What makes steroids especially tricky is how often they're prescribed. Millions of people over 60 receive them for joint pain, arthritis, sinus inflammation, lung conditions, or skin flare-up. They often work so well in the short term that patients keep requesting refills, unaware of the slow, hidden toll these drugs can take. The effects aren't always dramatic at first, just slightly higher readings at the doctor's office or mild ankle swelling. But over time, that constant upward push on blood pressure can lead to serious complications. The good news is that there are safer ways to manage inflammation and pain without the same cardiovascular side effects. Doctors often recommend tapering steroid use whenever possible and exploring alternatives such as targeted physical therapy, anti-inflammatory diets rich in omega-3 fats, gentle exercise, or short-term use of topical steroid creams rather than pills. In some cases, non-steroidal options or newer biologic medications can help control inflammation more precisely with fewer systemic effects. If you've been on steroid medication for more than a few weeks and noticed changes like swelling, persistent fatigue, or rising blood pressure numbers, talk to your healthcare provider. Never stop steroids abruptly. Doing so can be dangerous, but your doctor can safely adjust your dosage or transition you to a different treatment plan. The main takeaway is that steroids can be life-saving when used correctly, but they're powerful drugs that demand close monitoring. What starts as short-term relief can quietly become a long-term strain on your heart and arteries. As with all the medications we've discussed, awareness and communication with your doctor are key. Because when it comes to managing blood pressure, even the smallest pill can make a big difference in how your heart feels every single day. The rise in pressure can be subtle at first. You may feel fine, maybe just a little flushed or restless. But as the weeks go by, some people start to notice headaches, swelling in the ankles, or sudden changes in energy. Those can be early signs that the medication is putting extra stress on the cardiovascular system. And here's something even more surprising. Many people who take steroids for joint pain or inflammation are also on blood pressure medications. But the two drugs can work against each other. While one pill tries to lower your numbers, the steroid is quietly raising them back up again. It's a tug-of-war that leaves many seniors wondering why their blood pressure readings never seem stable no matter what they do. Doctors say the key isn't to fear steroids, it's to use them wisely. For short bursts of treatment, they can be life-saving. The real danger comes from long-term or repeated use without close monitoring. If you're taking steroids for more than a few weeks, cardiologists recommend checking your blood pressure regularly at home. Reducing salt in your diet and staying well hydrated can also help limit the fluid retention steroids cause. And whenever possible, ask your doctor about non-steroidal options like physical therapy, targeted anti-inflammatory foods, or milder medications. The bottom line is this: steroid pills are powerful, effective, and sometimes necessary. But for people over 60, they can come with a hidden cost. Gradual increases in blood pressure that build up quietly over time. If you've been feeling more tired, swollen, or lightheaded since starting a steroid, don't brush it off as aging. Bring it up with your doctor. A simple medication adjustment or tapering plan could make all the difference for your heart. Because protecting your blood pressure isn't just about avoiding salt or stress. It's about knowing how every pill you take affects your body. We've just uncovered 5 of the most common pills that can quietly raise blood pressure in adults over 60. Pain pills like ibuprofen or naproxen, cold and sinus medications that contain decongestants, antidepressants and sleep aids, certain heart and blood pressure drugs when not carefully managed. And finally, steroid medications like prednisone that bring quick relief but can build up hidden pressure inside your body. Each of these medicines can be helpful when used correctly, but when taken long-term or without close monitoring, they can slowly work against the very organ they're meant to protect: your heart. Here's the truth most people never hear. High blood pressure isn't always caused by salt, stress, or genetics alone. Sometimes it's the side effect of a pill you've been taking for years without realizing it, and that's why cardiologists emphasize the importance of medication reviews, especially after age 60. Your body changes with time. The kidneys, liver, and heart all process medicine differently as you get older. What worked perfectly for you 5 or 10 years ago might now be too strong, unnecessary, or even counterproductive. That's why understanding how your medications interact with your body today, not years ago, is so important. The good news is, you don't have to figure it out on your own. If you take any of the medications we've talked about, don't stop them suddenly or make changes by yourself. Instead, bring it up at your next doctor's visit. Ask, could any of my medicines be raising my blood pressure? That single question can open a conversation that could protect your heart and extend your health for years to come. Simple lifestyle choices can also make a powerful difference. Staying active with gentle daily movement, eating fewer processed foods, staying well, hydrated, and getting enough sleep all help your medications work more effectively and keep your heart stronger. It's easy to dismiss feelings like fatigue, dizziness, or swelling as just part of getting older, but often those are your body's quiet signals that something is out of balance. Take a moment this week to really look at your medicine cabinet. Write down everything you take, including over-the-counter pills and supplements, and share that list with your doctor or pharmacist. It only takes a few minutes, but it can prevent months or even years of silent strain on your heart. And remember, the goal of this video isn't to scare you away from taking medication. It's to help you use it wisely, with full awareness of how each pill affects your body. Because your heart deserves that level of care and attention, every single beat of it. If you found this video eye-opening, share it with a friend or family member who takes any of these medications. It might help them avoid a serious health setback or finally understand why their blood pressure hasn't improved. And if you haven't already, make sure to like this video, subscribe to our channel, and click the notification bell so you never miss the next episode of Mastering Your Health. We release new, science-backed videos every week designed to help you stay strong, active, and independent, no matter your age. Your health is your greatest investment. Protect it. Question it. Keep learning. Because every small step you take today leads to a stronger heart and a longer, healthier tomorrow.